and welcome to the Comfort Connections podcast. In this episode, Dementia Care Navigation, Facts, Figures, and Best Practices, we are joined by Kristen Moore Bennett, Health Systems Director at the Alzheimer's Association. Aging services professionals tune in to hear insights from the 2024 Alzheimer's Disease Facts and Figures Report and key challenges faced by caregivers and healthcare workers in helping people living with Alzheimer's disease or other dementia navigate the healthcare system. Welcome, Kristen. Thank you for joining us today.
Thank you. It's great to be here to share some insight with your listeners. Unfortunately, the statistics aren't pleasant. An estimated 6.9 million Americans 65 and over have Alzheimer's dementia, which equals 10.9% of that population. And that's just the number that are being accurately diagnosed.
Wow, Kristen, those statistics are staggering. It goes into recently, the Alzheimer's Association released its latest 2024 report, Alzheimer's Disease, Facts and Figures. Can you share some background on that report with us?
It hit the wire about 2 weeks ago, and the 2024 Facts and Figures report, along with a special report, mapping a better future for dementia care navigation. And since its inaugural release in 2007, the Alzheimer's Association Facts and Figures report has been the go-to source covering the broad spectrum of various dementia-related issues. The release of this most recent report is timely as the number of people affected by dementia as either a patient or caregiver is continuing to explode, as I mentioned earlier, as the baby boomers age. By this time next year, 2025, all members of the baby boomer generation will be over 65. So the population of 65 plus is projected to go from 58 million in 2022 to 82 million by 2050. Also in 2050, the number of Americans living with Alzheimer's dementia is expected to reach nearly 13 million, which would be double of where it is today.
Those numbers are shocking. With this in mind, could you share with our listeners what are some of the key updates and insights from the 2024 report, especially regarding the challenges faced by caregivers and healthcare workers when helping people living with Alzheimer's dementia or other dementia navigate the healthcare system?
Yes, it's tough because the burden on Alzheimer's disease and related dementia caregivers is significant. In 2023, close to 11.5 million caregivers provided nearly 18.4 billion hours of unpaid caregiving, which was valued at $346.6 billion. 59% of these family caregivers with report having dementia-related stress because of their caregiving, and they say it's very high or high. 38% of the caregivers report physical stress, which takes a toll on their own health and well-being. On top of that, 60% of these caregivers were also employed during the last year. Can you imagine trying to focus on work when you're worried about your loved one at home and worrying about your job while you're caretaking for your loved one? A little over half of these caregivers report having to take time off or go in late, and 16 had to take a leave of absence. Not only is coordinating care stressful, but compound it with the fact that 66% have difficulty finding the resources and support they need. That's why it's so important that this report comes out every year so people realize that the Alzheimer's Association is available 24/7 at the 800 number 1-800-272-3900.
The stress that these families must be experiencing is remarkable. And it's good to know what resources are available. Can you touch upon a few of the insights the research revealed into the experiences and challenges faced by caregivers and healthcare workers when helping individuals living with Alzheimer's dementia or other dementia navigate the healthcare system?
Unfortunately, the bottom line is there are not enough caregivers in the healthcare workforce to take care of the current population, let alone what's going to be happening in the next several years. So as the prevalence of Alzheimer's disease increases, so does the need for members of the paid workforce who are involved in diagnosing, treating, and caring for those living with the disease. The shortage of these dementia care specialists is a barrier to timely and accurate diagnosis, and a lack of diagnosis means a delay in treatments, care delivery, and supportive services. 55% of primary care physicians caring for people living with Alzheimer's disease report there aren't enough dementia care specialists in their communities to meet patient demands. One of the initiatives for the Alzheimer's Association is to prepare primary care physicians to manage these patients at the primary care level until it's warranted to be referred to a dementia specialist. Also, there's a substantial difference in specialist availability between urban and rural settings. 44% of PCPs in a large city and 54% of those in a suburb near a large city reported there were not enough specialists in their area. In contrast, 63% of PCPs in a small town or city and 71% of PCPs in a rural area reported a lack of specialists. Shortage of dementia care specialists and direct care workers are compromising care for people living with dementia. Between 2012 and 2022, the number of direct care workers increased from 3.2 million to 4.8 million due to growing demand for long-term care. More than 1 million additional direct care workers will be needed to meet the future demands between 2021 and 2031. More new workers than in any other occupation in the United States. 21 states expect to see a 30 to 40% increase in the size of the workforce, and in my state of Arizona, it's expected to need to increase by 50%. Although sizable, these employment projections fall short of true workforce demand. It probably wouldn't surprise you that turnover rates remain high, estimated at 77% annually for direct care workers and 99% for nursing assistants in nursing homes.
Kristen, those statistics are quite a lot to look at. And while you were reviewing them, I kept thinking, oh my goodness, that is a lot of information and heartbreaking to hear. And what it sounds like you're describing is that really there is a lack of dementia care specialists, but really we need to have the primary care involved more, especially in these rural areas, to be available for these individuals that need care and diagnosis.
Exactly. And what it really comes down to is dementia care navigation. Instead of, the automatic referral to a specialist, many patients can be taken care of in their primary care practice with the help of dementia care navigators. So in the accompanying special report of the facts and figures, Mapping a Better Future for Dementia Care Navigation, there's a comprehensive look into the dementia care navigation, surveying caregivers and healthcare workers on their experiences, challenges, awareness, and perceptions of care navigation in dementia care. Dementia health care is a complex maze composed of primary care providers, specialists, social services, medication management that caregivers often have difficulty understanding and accessing various aspects of care. Surprise, surprise, dementia caregivers experience difficulty and stress in interacting with the healthcare system. The cost and care coordination are top stressors for dementia caregivers, and care navigation is an unfamiliar term for most dementia caregivers, although they may receive help. I recently experienced an issue with my father back east, who does not suffer from dementia, luckily, but he is 80 years old and was in and out of the hospital several times over the last couple of months. And the cardiologist wasn't talking to the infectious disease doctor, who wasn't talking to the urologist. So care navigation is something that's needed across the board for our most vulnerable adults. Some of the top services that would be helpful to dementia caregivers include around-the-clock support, care coordination, and help understanding their care recipient's condition. Overwhelmingly, caregivers would welcome dementia care navigation support and believe it would benefit both the person living with dementia and the caregiver. From a healthcare provider perspective, a majority, 60%, of healthcare workers surveyed believe that the U.S. healthcare system is not effectively helping patients and their families with this dementia care navigation. It then falls to the non-physician healthcare workforce to provide these navigator-type services to patients and caregivers, in addition to all of the other responsibilities of their role. The healthcare workers included medical professionals, so your nurse practitioners, your physician assistants and registered nurses, and non-medical professionals, healthcare social workers, community health workers, and home health aides, all of which we are in great demand of. Healthcare workers providing care navigation say more can be done to help patients and family navigate dementia care, but point out current barriers. Most of the non-physician healthcare providers surveyed are familiar with care navigation and provide some sort of navigator-type services, even if it's not their focus. Most non-physician healthcare professionals who provide navigation have experience with other medical specialties, with few working on teams that are focused extensively on dementia. The majority say, and I'm going to underline this 10 times, the majority say that the training in dementia care navigation is lacking and not standardized.
Absolutely, Kristen. Care navigation, like you said, even with your own example, it's so important for, of course, our dementia clients, but it's important all around. So it's really important to consider this and what our training will look like and how we'll hopefully improve this process. As we near the end of this episode, are there any additional best practice considerations that you share with physicians, nurses, case managers, and other aging services professionals, especially with your work through the Alzheimer's Association?
First and foremost, I say keep up the good work to those people that are helping provide care for our aging loved ones. They are a generation that deserves respect and the utmost of care. And here are some of the next steps forward, basically bolstering the future of dementia care navigation. So findings from the Alzheimer's Association do indicate that dementia caregivers want and need help navigating the current healthcare system, as we were talking about earlier. And studies show dementia care navigation programs can offer significant benefits to people living with dementia and their caregivers, improving health outcomes, reducing healthcare costs, and lessening caregiver stress. And underlining the caregiver stress, it's not unheard of for the caregiver to predecease their loved one due to the stress associated with their own health and caring for them. Unfortunately, these care navigation programs are not widespread across the country. We're hoping that this report will be a catalyst for change. The report identifies 3 initial efforts that can be taken to advance dementia care navigation across healthcare. First, formalize dementia care navigator roles and build expertise in dementia care. This one's a biggie for me. Number 2, incentivize and reward care coordination in dementia care navigators. Third, leverage technology to create direct lines to dementia care navigators. So by formalizing the dementia care navigator's role, we will build expertise in dementia care. Our survey found many healthcare workers are performing care navigator duties, like I said earlier, additional to their other responsibilities. So practices and health systems should explore opportunities to transition from an ad hoc navigation support to formalizing dedicated dementia care navigator roles. By formalizing these roles, it provides an opportunity to integrate care navigation into existing medical teams, ensuring people living with dementia and their caregivers are supported throughout the disease continuum. Our survey identified community health workers, social workers, and home health aides as being best suited to be dementia caregivers. These professionals are typically trained as generalists. Supplemental training and resources are necessary to build a solid foundation in both the practical and emotional aspects of dementia care. Caring for a patient with Alzheimer's and other dementias is very different than caring for other patients. and it requires specialized training and helping the caregiver to understand that they're living in the patient's world. And in order to best serve those patients, they need dementia care training.
So, Kristen, as I've been listening to you explain, what could help and what would improve, as the training specialist at ComForCare, my training ears have gone up, and I'm thinking, how do we get this information to the people that we need? What is the Alzheimer's Association working on in that regard?
I'm glad you asked. The Alzheimer's Association is developing a person-centered navigator training curriculum and certification that is slated for release later this year. This curriculum incorporates the Alzheimer's Association evidence-based dementia care practice recommendations, which can be referenced in the notes. In addition, our report identifies several dementia care training programs and resources that can be used to build dementia care competency currently. You can see that on page 112 of the Facts and Figures report. Dementia care training has the potential to increase the proficiency of care navigators, ensuring that they are well equipped to meet the distinct needs of individuals living with dementia and their caregivers. Back at it, incentivize and reward care coordination in dementia care. Healthcare workers in our survey say current reimbursement rates fail to incentivize dementia care and are one of the greatest barriers to dementia care navigation. These healthcare workers strongly believe that alternative payment models are important in providing future care coordination for people diagnosed with dementia. Without these new payment models that reward care coordination, many providers are ill-equipped to provide robust dementia care navigation support and services.
Thank you, Kristen, for outlining that information. Is there any update on CMS and how they are supporting dementia care management ongoing?
Most definitely. It's a good, quote unquote, time to be in the dementia care space. There has been a lot of news about dementia care, bringing it to the forefront of people's minds. And in July, the Centers for Medicare and Medicaid Services, basically CMS, is launching an 8-year pilot program in dementia care management. So it's called the GUIDE model. The GUIDE model is the Guiding and Improved Dementia Experience. And then it's supposed to test an alternative payment model to incentivize health systems that provide dementia care navigation. If you haven't picked up on it, I think it's really important to incentivize people to pay attention. So this new payment model will help enable smaller practices, rural practices, and inner city health centers that traditionally do not have the financial resources an opportunity to deliver dementia care navigation. This is for a traditional Medicare Part A and B patient. Medicare Advantage programs, some of them already have some meat in them when it comes to dementia care navigation. There are opportunities to build on this model and other successful models currently in place at larger health systems to implement dementia care navigation in a variety of practice settings. It's important to leverage technology to create direct lines to dementia care navigators. Dementia caregivers want and often need around-the-clock support to address urgent care needs.
Kristen, thank you for that information. Can you expand a little bit on what the support will look like for our caregivers and what the Alzheimer's Association provides in regards to support?
Yes. In the survey, dementia caregivers reported that the most valuable service that care navigation could offer would be a 24/7 helpline. The Alzheimer's Association currently offers a 24/7 helpline that I mentioned earlier that performs some navigation activities, such as assisting individuals with Alzheimer's or other dementia and their caregivers with recommendations for finding qualified care providers, general information about legal, financial, and care decisions, and referrals to local programs and services like yours. Ideally, access to this kind of 24/7 assistance could be connected directly with an individual's healthcare team, enabling around-the-clock support, which is why a 24/7 helpline was mandated for the new GUIDE model, as well as respite care, which I think is fantastic. Several companies are exploring on-demand, virtual, and app-based dementia care navigation. These digital platforms can be used to offer dementia caregivers and people living with dementia easier access to resources, appointment scheduling, and direct communication with their care navigators. These digital solutions should be viewed as complementary to traditional communications, such as phone calls and in-person visits. To be effective, these technologies must be user-friendly and accessible to all caregivers and compatible with any platform used by healthcare providers.
Kristen, that is so exciting that there will be something available that can be there for caregivers just as a resource 24/7. Something that I can't help but think back to is how many of our offices throughout the year are doing fundraising efforts for the Alzheimer's Association, and hearing you talk and go through just this one portion of what you guys have researched and gone through, it just shows us what these dollars are going towards and the difference that that's going to make, and how there are going to be programs and trainings that are available to keep helping with Alzheimer's and dementia. So that is fantastic. Kristen, where can our listeners download the 2024 Alzheimer's Disease Facts and Figures report? And can you share any other resources that they should consider as well?
Well, first of all, I wanted to thank you for your support in your fundraising. The monies that are raised go towards multiple missions within the Alzheimer's Association, care and support programs, education programs, my role as a health systems director in helping enact some sort of change within procedures and processes within the health systems. We have a very, very strong advocacy department that pulls through a lot of really good legislation. So we appreciate that you know that those dollars are going to good work. In order to download the very robust 2024 Alzheimer's Disease Facts and Figures report, you can go to https://www.alz.org/dementia/facts-figures. And keep in mind, the 24/7 online support is in multiple languages, and it is 24/7. And even if it's just in the middle of the night and a caregiver doesn't know what to do next, give them a call. They're there to help, as are many other community-based organizations that are out there wanting and willing to support patients and their caregivers, as well as the providers.
Listeners, we will also have the link to this year's Facts and Figures report in our show notes on our website. Kristen, thank you so much for joining us today. Thank you so much for the work that you do and for sharing this important information for aging services professionals. Thank you, Kristen. And listeners, we will also have the link to this year's Facts and Figures report in our show notes on our website. Again, thank you, Kristen, for joining us today. Thank you for the work that you do and for sharing this important information for aging services professionals.
It's been a pleasure. I look forward to the day when we're talking about brain health as opposed to reacting to the dementia crisis.
Listeners, to view resources, show notes, and access more Comfort Connections episodes, visit ComfortConnections.com. You can also subscribe and listen to our podcast on your favorite app. Thank you for listening and helping older adults live their best life possible.